Today we have to start a new course that is called Employability Skills. This is actually the last course for the level 4. And once we complete this and that 4.10 planning a new business venture, we are done with level
Yeah.
4. So we'll be then just submitting the assignments and going through the process. Employability skills, if I just read unit aim for you, it says it will develop understanding of the skills needed for the effectiveness in the workplace and their own employability skills. Now it depends on the person as well who is going to be employee in any workplace, whether an education sector, whether a corporate sector, or any healthcare sector, that do they have that quality which a person, an employee specifically, possess or not? That is what we need to see. With that, we are having total 4 learning outcomes for this course and respective assessment criteria. For some reason, there is no pass, merit, and distinction. Whole course is going to be considered as pass. We have to do all the assessment criteria. Today, I will be demonstrating 1.1 and the course title, that is employability skills. Right underneath, we have the indicative content. All these points, literally right over here, I have used in the slides today for my lecture. When you will be doing it in your assignment brief, you will be using this for 1.1. So most of the time, things that are directly given in the indicative content, you just need to, add description and answer according to the command word. That is it. So points you will be taking right underneath from your indicative content, and we have an assignment for this course as well. And in total, we are having almost 4 tasks. So task 1 only has 1.1, 2, and 3, and task 2 has the components of LO2 and only one component of LO1. So I tried the best to make the slides according to task wise so that nothing gets dismantled at the end. And we have suggested
Okay.
evidence. It always guides us where to proceed our work, though this time for this course, the suggested evidence, I felt it's easy, like because it's only just a para. Before that, everything is like literally according to the assessment criteria wise. Then we have command web
Oh,
description and the PDF. Again, it's important. You need to focus on it, whether it's a small word, a big word. Like today, as we're going to do 1.1, the word says discuss. So we're going to work on this, develop, I believe. The thing is, you need to just focus on the command web description. It will help you in what actually is required. Employability skills. Now, first, we need to understand in general, then, according to the context of your degree, that is health and social care at the business management. Employability skill is the one which everyone possesses. But when we talk in specific context to the health and social care, it possesses 4 set of essential skills, qualities, professional attributes that enable individuals to effectively secure, maintain, and excel in management roles within the health and social care sector. Like how you can pursue yourself in a sector, in an industry, when you have a degree of, let's say, in language, English or Persian. It's going to be really difficult. Person who is from an XYZ field cannot adjust in the medical field, nor in the one which is totally for the business people. So you need to learn about it. These are the core competencies and transferable skills required to be successful in the workplace, particularly in roles involving managing teams, resources, and services in the health and social care sector. Um, I would say that yes, this do have a competitive edge when we talk about employability skills because it's mandatory whether you have a doctor degree, any degree, if you want to open up a cafe or you want to start a new business, it is mandatory to do a master's in business administrations, MBA. Like it's a mandatory thing no matter who you are and what your education was. Why it's a mandation? because it's important to know each and every component of a business. Only then you would be able to run a business, right? And you will face loss too, or sometimes a boom too, but it has many consequences. With that, it helps us to manage the teams too. That is, when we work with the people, we know how to handle them, and when the resources they are already scarce, less in number, less in quantity, so it gets really easy to manage, to make things manage for us and for the company as well. That is what the employability skill is. Like this is what most of the time we observe in the home as well. That is, people always like those who, with the less resources, can do anything. It's not mandatory that we have a chunk of money or a chunk of resources and only then things can be made. No. This is your skill with less, how you can do things within a most uh, excellence. Then these are the core competencies and transferable skills required to be successful in the workplace, particularly in the roles involved managing teams, resources, and services in the health and social care sector, like a team chart, a whole table of content type things, just to make sure that all these terminologies are clear to you. And these are according to the employability skills. First of all is communication. What it is: clear and effective communication with the staff, patients, families, and professionals include written, verbal, and non-verbal communication. It doesn't mean that we are communicating like the way you're listening my voice and I'm listening yours. No, the way you write, the way you are punctual with the timing, sending up the things, that is too under the category of communication, and it's so important. Most of the people, they really don't care about it. They don't know even that how to write up an email as well. Teamwork, ability to work collaboratively with the multidisciplinary teams, that is doctors, nurses, social workers, etc. Yes, it's not like if you have studied from outside, you won't be able to adjust in your own country's hospital or any center. You have to. Problem solving, critical for resolving patient care issues, managing complaints, or operational challenges. That is the daily issues you are facing, whether you are able to solve it or not, or you need a guidance from your MDs or the entrepreneurs. Leadership, managing and motivating care staff, allocating duties, and ensuring the quality care delivery. Really important. Whether it's a firm, a company, it's a hospital, it's a dental clinic, any sort of a place where the medical facilities are given specifically. It is like you need to be quite nice with the leadership qualities. You cannot always mangle the people with a lot of work, and at the end, what happens? Most of the people, they even doze off during the operations. Time management, prioritizing the task, meeting the deadlines, and managing the staff schedules effectively. That is, everything should be done punctually, by the time, by the date, and everything. Adaptability, adjusting to the changes in health policies, technologies, and the patient needs. According to what they desire from the doctor, from any senior person, we need to adjust them accordingly. Like most of the people, uh, they have the private wards in the hospitals. They're not comfortable in the government one. So that is their own choice. And it's our responsibility to be adaptable with them as a doctor, as a nurse, as anyone. And then we have ethical and legal understanding. Knowledge of safeguarding the patient rights, confidentiality, and relevant regulations. That is, you're not abiding by the laws, you're following it. Decision making, make informed, timely decisions in high pressure situations. Like, when the COVID came, it was a very high pressurized situation for every economy in every country. They were releasing new laws, they didn't even know how to handle it, but everyone was trying their best to couple up with this. IT and digital literacy, using electronics, health records, care management software, and communication tools. This is very important. I was also about to say this point in the factor leadership. When you hire people, it is not only from the health department. You have to hire from all kinds of degree holders because the person who has to handle the reception work, their degree is going to be from the business management and finance. Cash and balance is going to be managed by someone else. The IT person is going to handle all the electricity of the hospital, any clinic, like that. So we require everyone. You alone cannot do anything. It is going to be really difficult. Yes, but knowledge is mandatory. You should know that how things are done. Not in detail, but okay, that this also exists. Then we have customer service, ensuring the patients and families receive respectful, high quality care, depending on the area and the country, and then the hospitals. There is a huge difference in the facilities of the medical aid as well. Not everyone receives the same. There, there are different categories. Now, why are employability skills important in health and social care management? Like, this is the terminology used in the business management context, employability skills. But why do we need to focus on in this certificate? Ensure safe and high quality care for the service users. They won't be felt neglected at all. Promote efficiency in running healthcare or care home operation because most of the hospitals and clinics are now the businesses. They have the branches too. Health managers comply with policies and regulations. No matter what you are, what sort of service you're providing, you are answerable to the government and the policymakers. Foster positive work environments, improving the staff retention. Most of the people, they love to binge up on the jobs. They don't like their roles in the first hospital, they go to the clinic or sometimes go for the private ones too. Enable effective resource and budget management. All businesses, all sector requires money, capital, and investment. So we need to be quite adroit about it. Support continuous improvement and innovation in the service delivery. Service delivery, if I talk in the healthcare context, is obviously the care which we provide to the patients. When I used to go on the routine follow up, the people who were from the lower society, they were treated like, honestly, they're nothing. The doctors, they don't upon those patients, nor even the attendees. And the nurses, they're also very rude with them. So that is wrong. That is a discrimination too of the classes. It's not like if you are in a government hospital, it is free for the public, and public can be of any size, type, race. You need to at least respect them. They're humans. Then a healthcare manager must, like obviously in a hospital too, we have the managers who manages things and everything. It's like so many things there. First is communication or communicate. Policies clear assistance. And the newbies, the one who come on the internships, we have to tell them each and everything in detail, and then they can execute it. Lead team meetings and handle the conflicts. There are issues there as well, so we need to handle it. Manage time during the staff shortages. Sometimes we hire newbies, like at the time of COVID, all the new interns were hired. They didn't even knew how to inject the injections. But because of the shortage of people and plenty of people were having the coronavirus, we need to hire them. Use IT systems to update patient records. Yes, for that, everything was recorded through the manual system. Now everything's recorded in the computers and solve the problems like bed shortages or complaints quickly. Uh, I personally knew cases in the hospitals where what they do with the patient is if they're done with their life or about to be done with their life, like about to be dead, uh, they convince their family to just take them to their homes because they need to adjust another patient on that bed. And it happens in the government hospital. And it is so heart wrenching that they do this. Like in the hospital, we have a hope that, okay, everything is going to be and is. That's true. It's controlled by Allah subhanahu wa ta'ala. But then the doctors are there. They are the people who know the knowledge. But nowadays, it is a business. Honestly, it's a big business. Now, lecture one is according to task one. Before that, I wanted to just demonstrate that what actually employability skills are. And we are going to talk in the specific context of health and social care. because that is, a foundation. Okay, develop a set of own responsibilities and performance objectives. Now they are directly talking to us as a candidate that how we're going to handle the situation when we have to talk about our own responsibilities and the performance objectives. Points are already mentioned in the indicative content. We're only going to use that and give enough of the explanation. The word develop means to identify, build, and extend a topic, plan, or idea. In general, these terminologies like own responsibilities, performance objectives, they're just like two words. But when it comes with the command web description develop, you have to do work. You need to first give the definition. Then you have to build an extended topic. And how we do that? By adding stuff into it now. And then we can add further recommendations if we are able to build up a scenario accordingly. In today's competitive health and social care environment, personal and professional responsibilities play a pivotal role, vital, pivotal, both are same, in enhancing the individual performance, ensuring ethical standards, and achieving organizational goals. No matter what, in every sort of field, you need to focus on what? First, the individual performance, yourself, and then the ethical standards. Ethics are important whether you are at a commute, you are an organization, or you're working within yourself too. Ethics must be there. And achieving the goals of the that is the objectives of the organization. Even hospitals do have the objectives which we need to follow. Assessment criteria 1.1 explores the key components of these responsibilities and outlines the performance objectives with relevant examples from the authentic SMEs in Saudi Arabia and Bangladesh. Most of the people and candidate which I have experienced while checking the assignments, they have used old examples of SMEs in KSA. And for some reason, when I just encountered them, I told them that you could not use the examples from the AI tools. Like students do it now, just to save up the time. Why? Because their data is not updated all the time. They have just stored information which they're providing. It takes time to like update those applications as well. So it's better to just search that whether that company exists or not is simple. Go on the stock exchange. There you have the authentic SMEs listed and surroundings. The first point from indicative content was the personal responsibilities, and we have the points underneath. These are the internal obligations that define how individuals conduct themselves in the workplace. What it means, conduct themselves in the workplace, how they act, how they perform the duties. Personal responsibility shapes the character, the way you are acting, promote teamwork, the way you are working with everyone, enhance service delivery, especially in the patient-centered environments, how you're making sure that everyone gets the excellent service by you, yourself. The first point was direct and indirect positive relationship under the category of personal responsibilities. Now, what it is? Building respectful and cooperative relationships with the direct contacts. You're directly contacting whom? The colleagues, the patients all the time, right? And indirect with the suppliers, partners, and community. Suppliers, the one which are supplying all the medications, the gadgets, the tools. The partners, hospitals are not run by an individual. It is a team of people who run it. Community, the general public, then we have explanation. Encouraging mutual trust and respect within and beyond the organization strengthens the service outcomes. When you are conjoined, working together, services are performed betterly. Examples from both the countries. First, from the Saudi, in Al Safa Medical Complex SME in Daman, managers build direct relationships with the care staff and indirect ones with the pharmaceutical vendors to ensure smooth operation. Bangladesh, Amar Sheba Clinic SME in Kolana maintains indirect relationships with their local NGOs, non-governmental organizations for the maternal healthcare services. Because the people who don't have an access of nice facilities, at least they're getting it. Internal and external communication. Internal refers to the communication within the organization. That is how you talk with the people of that specific company. that is staff, management, while external includes the stakeholders, patients, suppliers, and regulators. Even a normal person have an encounter with the externals. Why? Because of the situations they can get in. Clear communication ensures efficient service delivery, accountability, and legal compliance. Service delivery, that is, it happens that first you will pay and then you will get the service. Then everybody just bambles over you. The senior manager, as in the of the hospital, the doctors and the nurses, and when you're of a low society, they don't treat you the way the treatment should be. You're a person at least. Then, for example, in Green Crescent Health Service, TACA SME, regular staff meetings, internal and community awareness programs, external, like the regular staff meetings are the internal side of communication, and the community awareness programs are for the external information. Because an outsider is going to breathe about everything, boost the service quality. That is morale, motivation factor of the people working in the medical society. Then we have adaptability and flexibility. Ability to adjust to change, manage stress, and handle the new responsibilities efficiently. Um, the bombardment of the new work, you need to handle it very carefully and swiftly. In the healthcare, frequent policy changes, emergencies, and staffing shifts require adaptable leaders and workers. That is, it takes time. With that, it takes, patience too. For example, Al Hayat Physiotherapy Center Riyadh had to quickly adapt during the COVID-19 pandemic, offering telehealth services, that is through the phone and through the internet, open to learning and development. This room should never be closed by anyone. Uh, Willingness to gain new knowledge, upskill, and embrace lifelong learning. That is, you have that spirit. If that spirit dies, I feel like everything gets doomed. Explanation. In a sector that evolves with the tech and treatments, continuous learning is essential for person and service growth. Like you cannot rely on the old school thoughts, right? That open to learning and development. In a sector that evolves with the tech and the treatments, continuous learning is essential for the personal and service growth. Yes, you cannot stop at any stance. If you want to pursue in the field, you want to grow and grow, you need to learn things too. For example, staff at the, again, a very difficult day for me, Shanti Health Clinic, SME in Rajshahi, undergo monthly training on the patient care ethics and use of the new diagnostic tools. Even in the medical field, the doctors love to go for the testing on the patients. What's the result with this new technique, and what was the result with the old technique? And that is how you do the experiments too. And the patients didn't even knew it. They're like trusting the doctors blindly. We have communication and interpersonal relationship. In an organization, it is mandatory to work on the skills of your communication, with that, the interpersonal skills. The ability to effectively convey the information and maintain positive, respectful interactions. Respect is really important, whatever or in whichever field you want to go in. Like it's a thing which we need to obey in every sector. Explanation. This is crucial for the teamwork, conflict resolution, and emotional support in health social care settings. Because in the health system, we need to have, an emotional intelligence with us, a thing which a care, a kind of love, and be soft spoken to. You cannot be harsh all the time because the situation the patients are facing. Not everyone is happy to come to hospital. People come to hospital due to many problems. Some are fighting with their lives. Some are just, coping up with the daily routine checkups. And slowly and gradually, things are like this. For example, a family clinic in Riyadh managers resolve disputes by mediating with the empathy and maintaining transparency in communication. That is what they're best. They are trying to have a balance with each and everything, with the patients too, and with the patient's family. Professional responsibilities, the number 2 point. First, we are done with, yeah, personal responsibilities. All the points were your from indicative content. And then now comes the professional responsibility. Now, this aligns with the legal ethics and performance based. expectations of the job role. Depending on the type of job, the nature of the job, things changes. Like how you're going to act, what specialities you possess yourself, everything will be discussed under this heading. The first 2.1, that is the actually subheading, is the business ethics. Again, all is from your indicative content. That is the principles, the laws, and values guiding behavior in a morally and socially acceptable way. That is the one which we have to accept from the society and from the surroundings. Explanation. It includes honesty, confidentiality, patience, respect, and responsible resource use. How honest you are. That is also very important. Few people, they are not honest with their job, nor with the patients, nor with the surroundings. But I feel like if you really want to have the bond, try to be honest. Honesty is first tool. With like in every case. Then confidentiality. If someone has shared something to you and it's something which doesn't needs to be publicized, like you don't need to public everything all the time, then at least respect it. They have trusted you. That is why they have shared something. Please keep a shadow on it, least. Patient respect, really important. Like most of the doctors I have seen in my own life, they enraged you. They even harass you from the words. Harassment is not all the time physically like that, or it is just by the words too. The way they talk, the way they pass comments, it just feels like you cannot even do anything because you need the treatment. You're bound to take the treatment. And when you're at a hospital, the doctor should know that if they are there at the patient, like the at the bed at the persona clinic, they require the treatment. That is why they're there. They're not by their own will. So at least give them the respect. They are the humans. Responsible resource use, how you're using the resources to calculate each and everything, that is also mandatory. Like I remember, I don't know, I used to watch documentaries because still I love to watch documentaries. Then comes employment legislation, laws that protect both employers and employees. Now we have two components in the medical, not in the medical field, in any field, in the management side or the business side. There are employers as well, and there are employees as well. Employees are the people who work for you under the category of subordinates, and employers are the one who are employing the employees too. Like they are giving the training to, and they are making sure you get hired as well. Like you're working in the organization, you saw a vacancy free, and you call your friend, please just come to the XYZ organization, give the interview, and there's like a small kind of reference attached to it, and then he or she gets the job. That is what an employer and employee is. Regarding working hours, contracts, benefits, and workplace rights, this is under your job description. Specifications tells us what we need to do. In the description, the specifications. In the description, we get to know that what responsibilities are of us. And in the specification, things are mentioned, when you will be paid, how things are going to be, and everything is discussed accordingly. Then, yeah, knowledge and the application of the labor laws are essential to avoid violations. You need to know the basic ethics and the laws to at least know that you are not violating at any stance. For example, the Care Point Diagnostic Limited in Chittagong follows the Bangladesh Labor Law 2006, ensuring legal contracts and rest periods. In any state of Bangladesh, even it's a district, it's an area, it's a proper developed city, every country has policies and laws. You can even see by your own self. Though it's a Bangladesh, if it's even Pakistan, we have the labor acts. Though they are late, they are made late in like in 2006 or 7, but we do have it. But people don't know about it, just because of a lack of knowledge. They are made sure that these people work day and night, and they pay the pay they get, it's really less. It's very less. We have employment rights and responsibilities. Rights include fair wages, safe conditions. Responsibilities include punctuality, job performance, and adherence to the rules. Rights. What are your basic rights for the job? That is what we need to know. The fair wages, you are paid equally. There is no discrimination among the men and women. Safe conditions, it is nice to work at the place. It's not, unhealthy for us at all. Then, under the category of responsibilities, we have punctuality by time. Time is really important. Punctuality is necessary. In Japan, if a meeting starts at 9, the candidates, the people, the workers, they are at outside of us around 8:30, maximum 8:40. And even the people who have to start the meeting, they come first. That is how much punctual they are in their lives. Job performance. Now, when you sign the job description and specification on your first day, whether you are following it or not, adherence to rules, again, everything is according to the law or not. Please, employers and employees must mutually uphold these standards to sustain a productive work environment. Everyone has to pour in, only then you can just go ahead. For example, okay, in Basma Home Care Services, Al Khubur, workers are briefed on rights, right? Medical leave and rest. Because you have a right. You have to take a rest if you don't feel like coming to the hospital on the daily basis. Then what they do, they are letting their workers to know that they have this service too. And responsibilities, that is patient safety protocols. Now they're trying their best to make sure that the person, that is the one who is getting the services, patient, is secured, and in return what the specific home care service is providing, that you can take a leave, you can take a day off if you feel like. You only need to inform. Problem solving, the ability to identify issues, analyze the causes, and implement solution. This is a nice technique which everyone should possess. Even in most of the curriculum vitae, the CVs, we see this that they have added the skills problem solving. Now, what they actually wanted to demonstrate, that they can pick up the problems, they can work that what caused that issue, they work on how we can overpower that problem and then implement the solution. Essential in handling the patient complaints, staff conflicts, or operational breakdowns. That is how things are going to be adjusted in each every context, because it's like a hospital of patient care stuff. That is why we have to, give the explanations accordingly. For example, in Shifa Diagnostic Lab in Australia, the manager resolved delayed report issues by restructuring the lab technician shifts. If there is an issue from that side, from the technician side, definitely it means to be a delay in the report and the test as well. Decision making. Choosing the best source of the action among the options, often under time or ethical pressure. Yes, if you're under pressure, it can cause a problem. Good decision making affects the patient's safety, resource use, and team motivation. When you discuss the things together, apart from whoever you are, it increases the safety of the patient. With that, how you're using the resources, all the things which are required to perform that job, and team motivation. You're motivating them at the same time. The manager at Wellness First Clinic Medina decides to invest in automated appointment scheduling to reduce the wait times. It's a nice thing. Before that, waiting times were quite high in most of the states.